Some of my patients come up to me and ask if gum disease automatically means that they will need to have periodontal surgery. Hi, I'm Dr. Kaz Zymantas here at Premier Dental Center, just 2 blocks east of Naperville North High School on Ogden Avenue, here in beautiful Naperville, Illinois. Gum disease is usually broken down into 2 states of the disease, gingivitis and periodontitis, or periodontal disease. Let's discuss the causes of periodontal disease and what can be done to control it. Gum disease starts when bacteria stick to a film on your teeth and begin to grow families. This sticky film with bacteria is called plaque. These germs give off poisons that create an infection in your gums. When the plaque has not been disturbed for a certain amount of time, your body begins to think that your tooth is a foreign object. Your body is literally trying to get rid of your teeth. Gingivitis is the first stage of gum disease. Gingivitis is present when only the soft tissues are involved. The gums may be red and swollen and can bleed quite easily when probed. Gingivitis can usually be treated by having a good hygiene appointment with a doctor or hygienist and by learning how to properly use brushes, floss, and possibly other devices to disturb the plaque on the teeth. Left untreated, the process of infection then usually progresses to become periodontal disease. When one has periodontal disease, the gums by the teeth begin to peel away from the tooth. The pockets open up and bacteria go deeper onto the root and begin to cause bone loss. When the pockets get too deep, one cannot clean the root surfaces properly, and the infection progresses until all of the bone is resorbed from around the teeth, and the teeth need to be extracted or they just fall out. Most patients with periodontal disease do not have any pain associated with the disease. The gums become much more swollen and red, and often there is pus oozing up from the deep pockets. The pus is because of the severe infection. Sometimes the smell from the pus can create very, very bad breath. Recent science papers have shown just how serious an infection periodontal disease can be. The infection is really just one big pussy sore with a total area of about 1/4 the size of the palm of your hand. This infection gets distributed to the bloodstream by the excellent blood supply in your mouth. The infection goes to the liver and makes new infection factors called C-reactive proteins. These C-reactive proteins then go through your entire body and begin to destroy many of the systems. You have a greater risk of developing heart disease, strokes, cancer, and numerous other problems because of these elevated C-reactive proteins. These proteins also reduce the effectiveness of your immune system. The flu season is coming up, and you have a greater chance of developing the flu if you have periodontal disease. Patients with this disease may need surgical treatment if there is too much bone loss. The objective of the surgery is to be able to have the patient get access to the roots to get rid of the plaque. Gum disease is very preventable, and the longer a patient waits to get help, the more bone loss occurs. So there you have it, the causes and the cures for periodontal disease. Early gingivitis can be controlled with rather simple therapy, but if you wait too long, you may develop a periodontal disease and then need further surgical treatment to correct and control the problem. In the whole field of medicine, there is no other problem that can be prevented as easily as dental problems. Our motto here at Premier Dental Center is, let's take care of little problems before they become big. I hope this video has been of help to you. There is more information and videos at the site listed below, or just call it the number listed below. Thank you for listening. Goodbye. Some of my patients ask me why their teeth are beginning to look smaller and shorter than they used to be. Hi, this is Dr. Kaz Zymantas here at Premier Dental Center, just 2 blocks east of Naperville North High School on Ogden Avenue, here in beautiful Naperville, Illinois. There is usually one reason, and that reason is that the person is grinding their teeth away. But doctor, I don't grind my teeth, they often say. There are many patients that have ground down significant amounts of tooth and were never aware that they were grinding their teeth. Some patients are not aware they grind during the day. Most patients' grinding occurs when they sleep and are unconscious. They cannot control the process. This process of grinding one's teeth together is called bruxing. Let's first talk about what causes bruxing. The true source of what causes bruxing is not known. There are two main potential issues. One is that the grinding occurs because one's bite is not properly balanced. Another is because of some sort of central nervous system mechanism. For some reason, there is a spot in the brain that makes you want to grind your teeth. When you grind your teeth while you sleep, you are much more destructive to the teeth because you can clench for a longer time and with more force than when you're awake. Often people have no control over this part of the brain, and for some reason it gets activated and people grind. Some people that grind have medical problems associated with this grinding and clenching. One of the major problems is headaches or migraines from clenching the jaws while grinding. The American Migraine Study estimated that there are 23 million persons older than 12 years of age that have severe migraine headaches. Bruxing may be the problem for some of these patients. So one wonders, what can be done to stop the bruxing? Well, in most cases, one cannot stop the grinding from happening. But fortunately, due to advances in technology, there is a device that can significantly reduce headaches that are caused by grinding as well as stop the loss of tooth structure. There are some patients that only need their bite balanced. When you balance a bite, you adjust the teeth so that they come together more evenly. So what is this newer technology? This device is called an NTI. The NTI is a removable, custom-fitted device to the upper front teeth. The NTI plastic touches the lower teeth and does not allow the teeth to come together and wear. The patients just glide around on this plastic and they wear out the plastic because it is a softer material than their teeth. One other remarkable thing happens when wearing this device. Because of the contrast of the upper anterior teeth, the power muscles are not activated. This means when you do grind, you will be grinding with much less force and reduce the stress on the muscles and TMJ. We have had many patients tell us that their headaches have completely stopped happening or have been reduced significantly after wearing the NTI for a couple weeks. Here is the main point to get from this. You need to get an NTI. Fixing teeth that have been ground down from bruxing is usually not cheap and not easy. You can save yourself a lot of time and money by just getting a device that will, for the most part, stop the further wear of your teeth. Not only do you destroy how the teeth function, but you could also destroy your smile. Everyone has seen the person with short, ground down teeth. Not very attractive. There are kids at 20 that have the smile of a 60-year-old. Our motto here at Premier Dental Center is, let's take care of small things before they become big. In all of medicine, there is nothing as preventable as dentistry. The technology to prevent most dental problems is here today. I hope this video has been informative to you. You can see other videos at the site below or just call at the number listed below. Thank you for listening and have a great day. Some of my patients ask me, what is a root canal and when do I know I will need one? Hi, this is Dr. Kaz Zymantas here at Premier Dental Center, just 2 blocks east of Naperville North High School on Ogden Avenue, here in beautiful Naperville, Illinois. In this video, I will explain what a root canal is and why someone may need to have one. When people say they're going to have a root canal, what they really mean to say is that they are going to undergo root canal therapy or treatment. All teeth have root canals. A root canal is a tube and chamber inside of the tooth. Inside of this tube is what is called the pulp, which includes nerves and blood vessels. When a tooth has significant decay, the bacteria from the rotting part of the tooth invade the pulpal tissues. This may lead to significant pain. In the process of nerve destruction, if the process of nerve destruction continues, the bacteria then exit the end of the tooth and then begin to create an abscess, which is basically a bag of pus at the end of the root. Bacteria can also enter into the pulp of the tooth if the tooth begins to split from heavy grinding. The nerves can also begin to die if there is blunt trauma to the tooth. Whatever the cause of the dying nerve, it has to be removed and the canal sealed so that bacteria cannot go back and forth into the tooth and back into the bone. The process of removing the nerve tissue and sealing the canal is called root canal therapy. This must be done to preserve the tooth. The alternative is to take the tooth out and you have a hole in that place. Most root canal therapy can be accomplished in one visit. It is also highly recommended to rebuild the tooth and get a crown on it to prevent fracture of the tooth. Most root canal treatment can be prevented by having regular checkups and cavity detection x-rays. Teeth with large fillings and patients that grind their teeth are also more likely to need root canal therapy. Untreated teeth that required root canal therapy can cause increased bone loss, significant facial swelling, and, unfortunately, possibly death. I hope that this video has been informative to you. There are more videos regarding dental care at the website listed below, or just call us at the number listed below. In all of medicine, there is no other field that is as preventive as dentistry. The technology to prevent most dental problems is here today. Thank you for watching. Goodbye.